When you think of a parasite infection, what comes to mind? You're probably picturing something pretty simple, right? A problem in the gut, a simple pill to fix it, and that's the end of the story. But what if that whole picture is completely wrong? What if the infection actually reaches into every corner of your body, and the drugs we use to treat it are powerful enough to reshape our own biology? Okay, let's dive into this. And that right there is the core idea we're exploring. We're moving way beyond just the gut to understand this complex, interconnected system where parasites, drugs, and our own bodies are in a constant, dynamic dance. So, here's our roadmap. We'll start by shifting our whole perspective. Then, we'll look at the seriously elegant weapons we use against these invaders. We'll explore the parasite's hidden reach throughout the body, uncover the surprising secret life of the drugs themselves, and finally, we'll bring it all together into a completely new ecosystem model of treatment. All right, let's kick things off with one of the biggest shifts in modern parasitology, moving from thinking of this as a localized problem to seeing it as a systemic web. For decades, the view was super straightforward, like you see there on the left. A parasite lives in the gut, steals some nutrients, and a drug just kicks it out. Simple. But that view, it's totally obsolete. The new reality, on the right, shows what's really going on. It's this complex network, and it brilliantly illustrates how a gut infection is tied to our lungs, our kidneys, our liver, our brain, even our metabolic health. Every part of the system affects every other part. Now, to fight these infections, we've developed some unbelievably sophisticated weapons. Let's look at two of the heavyweights, Mebendazole and Ivermectin. And these aren't just crude poisons. They are precision-guided molecular tools. Now, what's so cool here is the sheer elegance of mebendazole's attack. Think of a parasite's cells like a building held up by an internal scaffolding called microtubules. Well, mebendazole specifically latches onto the building blocks of that scaffolding, the parasite's beta-tubulin, and stops them from assembling. The whole internal structure just collapses. And when that happens, the parasite can no longer absorb glucose. It literally starves to death. Ivermectin, on the other hand, uses a totally different playbook. It's a neurotoxin. It seeks out these specific ion channels in the parasite's nerve and muscle cells and basically jams them wide open. This triggers a massive, uncontrolled flood of chloride ions into the cells, which completely shuts them down. The result? Total paralysis and death for the parasite. It's like kicking open a floodgate that just can't be closed. So, you might be wondering, if it's a neurotoxin, why is it safe for us? Well, it all comes down to a really cool molecular shield. Our central nervous system is protected by the blood-brain barrier, which has these tiny little bouncers called P-glycoprotein pumps. These pumps are amazing. They recognize ivermectin and actively throw it out, preventing it from ever building up to toxic levels in our brain. Okay, we've seen the drugs. Now let's circle back to the parasites themselves and explore just how far their influence actually spreads beyond the gut. And this isn't just some crazy hypothetical question. For some people, respiratory symptoms are the first and maybe the only sign of a gut parasite, and that can lead to a really dangerous misdiagnosis. This slide shows exactly how this can happen. Some parasite larvae, like strongyloids, go on this incredible migration. They break out of the gut, get into the bloodstream, and travel to the lungs. This can trigger a big allergic reaction called Loeffler syndrome, with symptoms wheezing, dry cough that look identical to asthma. And this is where we get the asthma mimicry catastrophe. If it's misdiagnosed as asthma and treated with steroids, that suppresses the immune system and allows the parasite to multiply like crazy, leading to a hyperinfection with an over 80% mortality rate. And the parasite's reach doesn't stop at the lungs. You've got the gut-kidney axis, where proteins from the parasites can get our immune system so worked up that it creates these little clumps that circulate in the blood, get stuck in the kidneys, and cause serious damage. And then there's the gut-oral axis. An infection like Giardia can mess up digestion so badly that sulfurous gases get absorbed into the blood and then exhaled, causing profound bad breath that has absolutely nothing to do with how well you brush your teeth. But maybe the most sinister example is the link between liver flukes and bile duct cancer. These parasites are not just sitting there, they are active engineers of disease. First, they cause mechanical damage just by living and feeding in the bile ducts. Second, this triggers chronic inflammation and oxidative stress, which damages our DNA. And third, and this is wild, they secrete a molecule that mimics our own growth factors, essentially hijacking our cellular machinery to force our cells to divide. It creates the perfect storm for cancer to develop. Okay, so we've established that the parasites have this massive systemic footprint. But here's the real twist in our story. So do the drugs. They're doing far more in our bodies than just killing parasites. This is where it gets really fascinating. These drugs are not just inert bystanders in our system. Studies are actually showing that mebendazole can interact with our pancreatic beta cells, potentially improving how we secrete insulin. Meanwhile, ivermectin's been found to act on a receptor in our cells called FXR. You can think of FXR as a master switch that helps regulate our body's own glucose and fat metabolism. The big takeaway here is that these drugs are acting as biological modulators for us, the hosts, not just for the parasite. And this has blown the doors open on an incredibly exciting new field: drug repurposing. The very same mechanisms that kill parasites are now being tested against cancer. Mebendazole's ability to collapse a cell's skeleton also works on rapidly dividing tumor cells, and ivermectin can block key signaling pathways that cancers rely on to grow. Same weapons, just a different enemy. So let's bring all these different threads together now. We really need to stop thinking about these as separate pieces and start seeing them as they truly are: a single, integrated ecosystem. 56%? What is that number? Well, get ready for this. According to some studies, that's how much lower your risk for metabolic syndrome could be if you have a chronic parasite infection. That's right, in some contexts, having parasites seems to be protective. How is that even possible? This is what's known as the deworming paradox. One theory, the old friends hypothesis, suggests our immune systems basically co-evolved with parasites, which have to release molecules to calm our immune response just to survive. So when we remove them, it's like taking the brakes off, allowing low-grade inflammation to just flare up. A clinical trial showed exactly this. After deworming, patients showed a significant increase in HOMA-IR, a key marker for insulin resistance. In other words, the cure for the parasite actually made their metabolic health worse. It's a cure with a catch. And this image just beautifully illustrates the whole story. Right at the center, you have the gut infection and its treatment. But you can see how the effects just ripple outwards, touching our lungs, our kidneys, our liver, our pancreas. It impacts our cancer risk, our metabolic health, and even opens up these new pathways for drug repurposing. It's all one system. So the ultimate takeaway here is this: mebendazole and ivermectin are not simple dewormers. They are profound biological system modifiers for both the parasite and for us. The future of medicine really depends on us treating the patient as a complex ecosystem and recognizing that curing an infection is a systemic event with consequences we are only just beginning to truly understand.